The recommendations in this video are not intended to diagnose, treat, cure, or prevent any disease. Please consult your doctor before taking any vitamins, supplements, herbs, medication, or trying any of the suggested techniques. Headache pain is one of the leading reasons why people see doctors, accounting for more than 10 million office visits a year. The three most common headaches are tension headaches, which are caused by stress, migraine headache, which results from the expansion and contraction of blood vessels in the head, and sinus headache, which stems from sinus infections or hay fever type allergies. Many headaches are not strictly one type, but rather a combination of two or more. Today we'll be discussing tension headaches. A tension headache feels like a steady, aching pain that wraps around your entire head. It's this pattern of pain that earned tension headaches the nickname hatband headaches. Like most other types of headaches, tension headaches have nothing to do with your brain. Rather, they originate in the muscles that run through your scalp and neck. Tension headaches are usually associated with stress, hence the name. A tension headache can strike at any time, though it's more likely to occur toward the end of a long, hard day. The pain can last from as little as half an hour to as long as several days. Only the most severe or persistent tension headaches require a doctor's attention. For more run-of-the-mill pain, you can usually get relief through self-care, using any of several effective, mainstream, and alternative remedies. The next time you feel a tension headache creeping up on you, try one of the following measures to keep the pain at bay. Visualization. Picture pain vanishing. Visualization exercises provide prompt relief from headache pain. They are an especially valuable treatment option for moms-to-be who are advised not to take medication during their pregnancies. Of course, you don't need to be a mom-to-be to practice visualization. When you feel a tension headache coming on, try this exercise. Begin by closing your eyes and taking 3 slow, deep breaths. Imagine that you're looking down at the top of your head. Lift off the top of your skull as if you were removing the top of the shell of a soft-boiled egg. Look inside. Imagine that your brain is a lake and that your nerve fibers are underwater plants gently waving in the current. Now imagine that the lake is being drained, and with it, all your tension. Once drained, your brain fills with new, clear water as fresh blood circulates all around your head, your neck, and the rest of your body. Imagine replacing the top of your skull. Take a final deep breath and open your eyes. Massage. Rub the right place. When headaches strike, many people rub their temples. Right approach, but maybe the wrong location. Studies have shown that tension headaches often originate in the muscles at the back of the neck. Massage those muscles for relief. Aromatherapy. Be partial to peppermint. In a neurology study in Germany, researchers instructed 32 people with headaches to treat their pain with self-massage of their heads and necks. Each person also used one of 4 aromatherapy preparations. The 2 preparations that contained large amounts of peppermint oil proved effective in relieving headache pain. Add a few drops of the oil to unscented skin or massage lotion and rub it in. Another good remedy is Tiger Balm, the popular Asian pain reliever that has been a health food store fixture for decades. It contains no tiger parts, but it boasts a generous helping of menthol, a major component of peppermint oil. Make sure you follow the package directions when using the ointment because it is very strong. Herbal medicine. Let willow whip your pain. Willow bark contains salicin, a natural precursor of the active ingredient in aspirin. To make the tea, add 1 to 1½ teaspoons of powdered white willow bark to 1 cup of boiled water. Simmer for 10 minutes, then strain. 2 other herbs, wintergreen and meadowsweet, also contain salicin. To make a tea from either herb, add 1 to 1½ teaspoons to 1 cup of boiling water. Simmer for 10 minutes, then strain. Chinese medicine. Revive your qi. Practitioners of Chinese medicine attribute pain to stagnation of qi, blood, or moisture. Many headaches involve some degree of stagnation of all 3 elements. The classic Chinese herbal formula for headache is called Chua Xiong Cha Piao. It contains quite a few herbs, including logisticum, angelica, asarum, and peppermint. It breaks up stagnation. If you want to try this herbal formula, you need to consult an Oriental medicine practitioner. For relief, press on. Research has shown that acupuncture as a headache treatment relieves headache pain significantly better than a placebo treatment. Of course, acupuncture must be administered by a trained professional. If you prefer a self-care approach, try acupressure instead. Apply steady, penetrating finger pressure to each of the following points for 3 minutes. Large intestine 4, located on the back of your hand where the bones of your thumb and index finger meet. Governing vessel 24.5, located between your eyebrows where the bridge of your nose meets your forehead. Governing vessel 16, located in the center of the back of your head, in the hollow at the base of your skull. Bladder 2, located on either side of your nose, where the bridge of your nose meets the ridge of your eyebrows. Stomach 3, located at the base of your cheekbone, directly below your pupil. Liver 3, situated on the top of your foot, in the webbing between your big toe and second toe. For chronic headaches, seek professional acupuncture treatments. Acupuncture generally provides greater pain relief than acupressure. Home remedies. Give pain the cold shoulder. 2/3 of people with tension headaches experience at least some relief when they use cold treatments. Here are 2 ways in which you can use cold treatments. Place a wet towel in your freezer until it's cold but not frozen. Drape it over your forehead or wrap it around your head or neck. Leave the towel in place for 10 to 15 minutes. Put a few ice cubes in a plastic bag, then wrap the bag in a clean cloth. Apply the ice pack across your forehead for 20 minutes, then remove it for 10 minutes before reapplying. Just don't apply ice directly to your skin, or you may give yourself frostbite. Keep a headache diary. Many tension headaches have triggers: emotional upsets, sleep disturbances, artificial sweeteners, certain foods or drugs or alcohol, especially red wine. If you are prone to tension headaches, keep a headache diary. Every time you get a headache, write down the date and time, as well as any psychological, physical, or emotional factors that might have contributed to it. Also, list all the food and beverages that you consumed within the previous 12 hours. You may see a pattern that you can change. Nutrition. Eat ice cream wisely. While a cold pack can help relieve a headache, a cold food, especially ice cream, can actually cause one. At least 30% of people develop head pain within moments of scooping a spoonful of ice cream into their mouths. Eat your ice cream slowly, in small bites or licks. Let it melt in your mouth. That way, it's less likely to touch the back of your palate and trigger a headache. Supplements. Increase your magnesium intake. Magnesium deficiency has been linked to both tension headaches and migraine. If you are experiencing chronic or fairly frequent headaches, take 200 milligrams of magnesium 3 times a day. But remember, always consult your physician first. Ayurvedic medicine. Blame your bowels. Ayurveda attributes tension headaches to problems in the colon, primarily constipation. When treating people with tension headaches, Ayurvedic physicians often prescribe laxative herbs, notably aloe powder and rhubarb, along with other herbs, including ginger, calamus, bayberry, and wintergreen. In addition, they suggest massaging the head, neck, and shoulders with sesame oil. Over-the-counter drugs and medical measures. Most everyday tension headaches respond well to aspirin, acetaminophen, ibuprofen, or naproxen, also known as Aleve. Which of these works best? Despite what the television commercials say, they all work about the same when taken in their recommended dosages. Which you choose depends on your individual preferences. Doctors treat especially severe or persistent tension headaches with an array of medications, including prescription-strength non-steroidal anti-inflammatory drugs, NSAIDs, combinations of pain relievers and narcotics, and even antidepressants. Because headaches are so common, and because they are chronic and complicated, special clinics that focus exclusively on treating them exist across the country. Consult your doctor to find one in your area if needed. If you found this video helpful, don't forget to like, comment, and subscribe.